Hypoplastic right heart syndrome from tricuspid atresia. That's a diagnosis I was given at SSM Health, Cardinal Glennon Children's Hospital on September 15, 1985. Hi everyone, my name is Stephanie Hall. I want to thank you for allowing me to tell my story today. My parents never had an ultrasound, so when I turned blue a couple hours after birth, it was a huge surprise. I was immediately transferred to Cardinal Glennon, where I met Dr. Sadi Al-Jardini. Little did my parents or I know that he would become my hero, my second dad, and the reason I am a 30-year-old patient at a children's hospital. He's the reason I'm alive today. When I was in second grade, we were told to write a paper about our favorite superhero. And while everyone else in my class was writing about Superman, Spider-Man, or Wonder Woman, I was writing about him. I even made up a little theme song for him. But needless to say, my teacher gave me an A. Dr. Jardini discovered that my tricuspid valve and my right ventricle in my heart had never developed. In 1985, this was a very rare diagnosis, and it did not have a defined repair. My parents were told I probably wouldn't live to be 10 years old. I had my first heart surgery at 36 hours old to temporarily redirect the blood flow in my heart. While all of this was happening, my mom was still in the hospital she had delivered me in, so the PICU nurses took pictures of me for her so my dad could bring to her. She had only held me one time before I was transferred, so this meant a lot to her. One of those PICU nurses was Mary Pat Spillane. She was one of the first nurses to take care of me after my surgery, and she now works in the cardiology clinic. It's hard to put into words what Mary Pat means to me. I call Dr. Jardini my second dad, but she is truly my second mom. She has been with me through every surgery and procedure, and all the good news and all the setbacks. She has been my family's rock and shoulder to cry on. Literally, she has held my mom while she cried, and she has held me while I've cried. Mary Pat is the one person I let myself have emotional breakdowns in front of, and she's the one I text in the middle of the night when I don't feel well. I honestly don't think I could have gotten through as much as I have without her. I was discharged from the hospital after 11 days, and I did pretty well for almost a year until it was time for my second temporary fix. I had my second heart surgery on September 6th, and I was just discharged on my first birthday. After that, everything went back to normal, and I even started dance classes. Since I was getting older and my body was pretty strong, the doctor said it was time for my corrective surgery, which we thought was going to be my last. So in 1989, 2 weeks after my first dance recital, I went in for the big one, an open heart surgery called the Classic Fontan that lasted 9 hours and 10 minutes. That night, my blood pressure plummeted. My parents were told I probably wouldn't make it through the night, and they had to stay in the waiting room while the doctors and nurses tried to stabilize me. My surgeon, Dr. Neil Pennington, sat by my bedside all night long. It meant so much to my parents to know that he was taking care of me when they couldn't. The next morning, I was opened up in the ICU and placed on an ECMO heart and lung bypass machine. This was the last resort. When my parents finally got to see me, I was taking up an entire double occupancy room with all the machines attached to me. At one point, I had 42 lines going to me. I was on the ECMO machine for 4 days. When I was strong enough for them to take my chest tubes out, the doctors wanted to numb the area with a lidocaine injection. I hated needles, so I told them I did not want the lidocaine. And they listened to the request of a 3.5-year-old and took my tubes out without it. It takes a pretty special doctor to request the wishes of a toddler. I was discharged after 13 days, and I went home only weighing 24 pounds. It took me a while to get my strength back, but I went on to play softball, dance, and cheerlead in high school. Until I was 18, I only went back to Cardinal Glennon for checkups and blood work. In my senior year of high school, I began having arrhythmias. I passed out during class, and I was taken by ambulance to Cardinal Glennon, where Dr. Jardini found that my heart was in an abnormal rhythm called atrial flutter, and I had a cardioversion to correct it. Over the next 7 years, I would need to have a total of 15 cardioversions because my heart kept going into atrial flutter. All of this put a lot of stress on my heart, and in 2011, I went into heart failure. My immune system was failing, and my body was filling with fluid. Luckily, I was able to wait to have another heart surgery until after my wedding, which, of course, Dr. Udini and Mary Pat attended. A few months later, I had the modified Fontan surgery, which lasted 11 hours. Dr. Andrew Fiore and Dr. Charles Huddleston were my surgeons. I was one of Dr. Charles Huddleston's first surgical patients after he transferred to Cardinal Glennon. I don't think he expected to transfer to a children's hospital and perform surgery on an adult. But the surgery ended up fixing the heart failure, but not the rhythm issue. So 6 days later, I went in for pacemaker surgery. I still have frequent follow-ups and blood work, and I take enough medication to fill Walgreens pharmacy. But since those surgeries, I've been doing pretty well. Dr. Giardini and Mary Pat will always be part of my family. I became a nurse because I wanted to be the influence in a patient's life that she was in mine. Dr. Giardini wanted me to work with him at Cardinal Glennon, but that was just so he could check up on me 24/7. They wrote my husband and I a letter of recommendation for adoption, and we adopted our beautiful daughter just 2 days after her birth in 2015. Mary Pat calls herself my daughter's grand nurse. My story begins with the diagnosis, but because of everything Cardinal Glennon, Mary Pat, Dr. Giardini, Dr. Pennington, Dr. Fiore, Dr. Huddleston, and all the other doctors and nurses did for me throughout the past 30 years, I do not feel like a diagnosis or a prognosis, but a person, and I cannot thank them enough for that. Thank you.